people. Welcome once more to another amazing slot of your very own safe pregnancy, safe delivery from no other but your very own OBGYN. Shout out to Dr. Nzometia. I'm a support system. It's been amazing here so far. If this is your first time, you're so welcome. Please enjoy yourself and enjoy this slot. Here we talk safe pregnancy, safe delivery from this particular slot. And it's such an amazing time for us to have you. We are going to go right away into the hot topic of today, which is always a question on the mind of every single woman after a C section, or every single husband or relative. Now that you've had a CS, doesn't mean that you will ever give birth vaginally again. Does it mean that you're condemned? Does it mean that that's the only child that you can have? And all the questions that always come. Okay.
Wow. greetings to all our viewers. Thank you for connecting to this program. And this is I think this is our third official slot. Yeah, we began with overcoming the stigma of going through a CS. Many people go through cesarean section. I saw one of my patients today, she told me she's still traumatized. She's still traumatized.
Oh,
And I was talking with her and it was fun. At the end she realized that it's that fun. Yes, so we continue by talking about how to deliver safely vaginally, how to have a safe vaginal delivery. And I already have many testimonies. I encourage them to come and share their very easy for me too and for them. So it is so interesting. Uh, this is our fourth live session, but the fifth video on safe pregnancy, safe delivery. The very first video is on the tragedy caused by the Hebrew month phenomenon.
mm.
We are still having some few tragedies. I had a testimony of one that occurred a few days ago. And also we are having many that are being saved because that video already has over 1,000 views. And we know each person who has watched that video has also spoken about it with others. So many people are being enlightened about it. Today, we are going into a very interesting topic. What are your chances of a vaginal delivery after going through a C section? And of course, it's a very interesting one because beside me is my beautiful wife, Dr. Mrs. Nzometia, a distinguished dental surgeon who went through C-section for her first baby and also had a successful vaginal delivery. So she's going to share her experience, which is of course interesting.
Very, very.
And so I want you to know that after going through a vaginal delivery, you have chances. After going through a C-section, you have chances of having a vaginal delivery, what we call VBAC, vaginal birth after cesarean section,
Mm.
VBAC. Last time, one of my patients testified on one of the videos. I followed her up until she had a VBAC, a successful VBAC. So recently, many of my cases have been successful VBACs. And because we are doing all the things, when we start following them up, we do strict follow up, we control the weight, and at the end, the weight is good. And they have their chances, and then we monitor them again, prepare them, and before they get to the time that we start thinking of induction because we don't induce such patients, they get into labor and they actually deliver the babies. So when you go through a cesarean section, the very first thing you must retain, and that's what you should leave the hospital with, is the reason for which you were operated. And it will shock you to know that many women don't even know why they were operated. You ask the woman, why were you operated upon? She tells you, I don't know. I was just in labor and maybe they told me the road is not there. That the road is not there. The road is not there, and then they just went ahead to pray. Thank you. I'm seeing my friend from the US. Please just write from where you are commenting so that they can further give us power in this video. So the reason for which we operated, it determines everything. Determines everything. And I want you to know that when people go through C-section, I was telling you that there are three major groups of indications, what we call indications or reasons. Um, there are reasons that are called absolute indications, indications that are called absolute indications. Absolute indication means they cannot change. They cannot change, and some of them may be permanent, some of them may vary with the pregnancy. They are what we call relative indications. Relative indication means it's 50-50. The person could deliver or she could deliver by C-section, and then you have what we call uh, you have indications that we give by sound judgments, following the person's history and following the person's uh, uh, clinical presentation, and also following the person's age. That is how. So that's how we have the reasons. And of these reasons, I've given you the absolute, the relative, and those by sound judgments. It could be due to the baby or the mother. So you have reasons that are linked to the mother and reasons that are linked to their baby. Those are the two big groups, great grand big groups, and then from there we have the three major indications. Now, when we talk about absolute indications for which a woman goes through a C-section, because you need to know when you operate upon, you need to know why you went through a C-section. Very, very important. You need to know why. If it's an absolute indication, what type of absolute indication? Let's take the maternal side. For example, you are operated upon and you are told that you have what we call a contracted pelvis, that your pelvis is very small. A baby cannot pass through. I told you there are 4 types of maternal pelvis. We are going to do a video where we'll talk about this. There are 4 types of maternal pelvis. So, if yours is the type that your pelvis is very, very small, because a woman's pelvis could be normal, it could be medium, what we call a borderline, or it could be contracted. Contracted means it is small and they are bones, they will never change. If the reason for which you operated is because you have a contracted pelvis, then your chances of undergoing a VBAC or going through a trial of scar, as we call it, or a vaginal delivery, becomes zero. They are reduced to zero. It means throughout you will deliver by C-section. Such people sometimes, when they force vaginal delivery in them, it tears everything, sometimes opens even the anus completely. We have cases like that, and sometimes those babies will come out already, they have suffered and suffered until maybe they're already dead. I saw a case of a woman like that who lost her 2 babies in the past, or even having a fistula because of that. So once the doctor tells you that, that's why when women are being followed up, they are sent to see us at 36 weeks of their pregnancy. In the video, How to Control Your Weight, we establish how you can calculate the age of your pregnancy. So we count it in weeks. You can watch that video to understand this better. There, if this reason, like I say, at 36 weeks, they send them to us to do what we call clinical pelvimetry to check to see if the pelvis is normal. And the pelvis has three sections. Three sections. So we assess all the 3 sections to see if the baby can easily pass through. I told you the baby does not just come like somewhere that's swimming or that is running on the highway. The pelvis is twisted. Wow. It's like how do you call Fales the dishank? You see. So if at that time we will tell them whether this pelvis is normal or not, because sometimes at that time also there is a hormone that is released that relaxes the ligaments and the muscles around there so the pelvis can open up a bit. That's what we call pelvic gift. That's why we check it at that time. If we tell you that it is contracted, sometimes with that we can further do what we call pelvis scan, and then if it is contracted, it means that forever you deliver by C-section. Your chances are zero. That is one absolute indication. If one of the absolute indications was the fact that there was a previous mass, maybe there was a fibroid around the cervix occupying the passage, and during your C-section it is removed, the obstacle has been removed, it is possible that next time you have a passage and then you try. If it was a fetal reason, for example, a reason linked to the fetus, a reason, no, let me still finish with the mother. In some nations like ours, there are some maternal indications that have been made absolute. For example, a woman that has had a double scar who has gone through C-section twice, unanimously was decided that she should go through C-section because several of them ruptured their uterus when they got into labor. Some few who stubbornly still go ahead in labor still deliver. I repeat, they still deliver, but the majority end up having problems. So for us in our nation, it is an absolute indication. It's an absolute indication. Now, you have some reasons that occurred specifically to women, maybe due to their past. For example, a woman who has a malformation in her vagina, for example, congenital malformation, or maybe there are some ovules that women used to use, traditional ovules that causes vaginal stenosis. In that case, or maybe she delivered in the past and had complex laceration that created fistulae, her indication becomes absolute because if she delivers again, it can worsen that fistula. So when she gets pregnant, it becomes C-section. Now, uh, fetal reasons, most fetal reasons may be absolute for that pregnancy, but not absolute for the future pregnancy. For example, a fetus that is breech in a woman that has never put to bed. In our nation, we usually advise a C-section. There are some types of breech, I will talk about that in another video, that they could go to deliver. Some people still go ahead to deliver them, which is very risky. But if the fetus is lying transverse, transverse means that the vertebral column of the fetus is perpendicular to that of the mother. That's transverse lie. The head is either on one side or here, and the fetus does not turn, remains there till term. When the weight has increased, space has reduced, can no longer turn, it becomes an absolute indication. It becomes an absolute indication. You see, so she will be operated. But in the next pregnancy, if her fetus is lying well, she has the chances of delivering her baby. So those are absolute indications. I told you some of them are not constant with respect to your pregnancies. There are some that become constant, for example, contracted pelvis or those past histories that I've explained. Now, coming to relative indications, let's take, I told you relative indication means that I can indicate a C-section and you say, I want to try, and you try and you deliver. It does not mean that I was wrong because usually people will go and say doctors wanted to operate me and I delivered because they are ignorant. They're ignorant, but we do well to educate them to know that this proposal we are giving is not absolute. It's not absolute because if we are telling you that we want to operate you, it's because we have also seen several reasons. And then you can say, okay, I want to try. So I always give the two options. And women choose. They say, okay, I want to try. And then they sign because sometimes if you go ahead to try directly without their consent and something happens, patients are quick at blaming doctors. So they may start blaming you. So usually what we do is when we have a relative indication, I'm going to give you an example. For example, a woman that is pregnant and then you suspect that she has a big baby, what we call macrosomic babies. A macrosomic baby is a baby that's above 4 kilograms. Usually, labor may be difficult and labor may expose to complications linked to the baby and to the mother. So sometimes we advise CS. We advise CS. Those, some will say, no, I want to try, and they will deliver. Others will say, I want to try, and they will not. You will still end up in CS. So that's a relative indication. Linked to the fetus, a relative indication. Is not absolute. Is not absolute. So that's an example. Borderline. When you have a borderline indication, borderline pelvis and you suspect that the baby is big, she can try. You give her the chances. She tries, and actually, like through a pelvic gift, the pelvic can open up again during pelvis during labor, and she delivers. The chances are 50-50 when it is a borderline, a relative indication. A relative indication. I've given one of that is concerns the mother, and one that can go to indications following sound judgments. This will further deliver people and cause people to talk less or to just complain without knowing. Many of these complaints are is due to ignorance. Let me give you an example. Doesn't have a child and has had, for example, like 5 miscarriages, and then she finally gets pregnant. That becomes a precious baby. That's how we call it. And then you can tell her that to avoid going through risks of labor, we can operate you to give your baby. She can accept, or she says, I want to try. You have people like that. And she can actually try and deliver. She could also try and have challenges. So there it is. She may even have a very good pelvis, but you judge that this woman should go through what? C-section. And you advise and she accepts. So if she refuses and delivers, you are not to blame. And she is not to blame. This is what I want us to understand. This is what I want us to understand. Okay? There is a woman that, for example, she got pregnant. She struggled to get pregnant. Pregnancy was not coming until she finally got pregnant, maybe after 5, 6 years. So women, like one of the women I shared in the tragedy of the caused by the Hebrew man, she struggled for 5 years until she had a pregnancy that was a male and she was 35 years. And she had been operated before. They told her you need to go through C-section. She refused. That is, doctors want to operate me for nothing. And in the course of time, she ruptured the uterus. She lost the baby and her womb. I'm the one that removed that womb because it got totally destroyed. There was no way to rescue it. Sometimes you could even rescue it. There was no way. So when you judge that, you advise some people will ask. Some will even tell that doctor, I want my baby myself. I want my baby myself. Some women will calm themselves and say, I want to be operated. That's what we call maternal request. In many nations today, they do that. She can have a very good pelvis. The baby may even not be too big, but she does not want her level, or maybe she was traumatized by her previous deliveries. It does not mean that she could not deliver. Do you understand? It's just simply what we call judgment. Now, a woman is pregnant and there are some diseases that are affecting her during the pregnancy. And then you see that labor may disturb her and you advise that she should be operated. That's a judgment that you have given. Is you have considered several things. This is why we do operate people. And that reason is very important and it's a big determinant in your future delivery. So, like I've given you, if you were operated because of a contracted pelvis, your chances are zero. Now, if it was not because of a contract, you could be operated for what we call CPD, cephalopelvic dysproportion, for example. It's one of the main reasons why we operate. Maternal fetal reason why we operate. Where the baby is coming out, but the diameters of the head, the baby's head present with different diameters. Sometimes it comes with the face, sometimes with the occiput, sometimes with the frontal bone, sometimes with the mentum. It comes differently. The fetus presents differently. Sometimes when it's coming down, the different rotations that your baby has to go through, the baby doesn't succeed and hooks up at some point based on the bones, your pelvic bones. We call it cephalopelvic disproportion. In that case, it is not it is not an absolute indication. It is a cephalopelvic disproportion. So in the future, we are going to judge to see whether this one can pass. That's how it is. I hope we understand this very well. Now, one of the frequent fetal reasons why we operate is fetal distress. A woman that is pregnant and she's in labor, and in the course of time, the fetal heart rate begins to disturb. There are several things that could cause that. The fetal heart rate begins to disturb. It could be caused by just the labor. the age of the pregnancy, or herself, or maybe there's a cut around the neck of the fetus. That's one of the main reasons on the hands or the legs, or maybe the placenta is aged. That's one of the frequent reasons. Is fetal distress. It has nothing to do with the maternal pelvis, so it's not an absolute indication. In the future, she could deliver now. That's why some women will ask you that I've delivered all my babies. Why should I be operated for this one? It's possible. You have delivered all your babies, baby. Or maybe this one, the cephalopelvis disproportion. One time when I was still in the field, I was not even yet a specialist. I operated a woman for 8 child. She delivered 7. And that one, there was cephalopelvic disproportion. There was cephalopelvic disproportion. So that is it. There was cephalopelvic disproportion. You see it. So that is how it happens. It happens like this. It happens like this. So now, when you have now gone through a C-section for an indication that is not absolute, before I say this, I want you to know that if you have gone through C-section twice, don't think of vaginal delivery again. Don't think of vaginal delivery again. It's very risky. It's very risky. There are people who are going into to the point of even taking enemas, that they want to deliver. This is so risky. It's so risky and is not wise. It is not wise at all. It's not wise at all. God is not a fool. And I told you, delivery is a matter of wisdom. And if you deliver by C-section, it is not lack of faith. It is not because you lack faith. You don't lack faith. It just happened, and God permitted it to save your life and that of your baby. That should be your concern. Now, if you went through C-section, the first condition for which you should do what we call a trial of scar or go through vaginal birth after C-section is that first you have a single scar. You have a single scar. You have a single scar. A single scar, we believe that it still has some strength. You have a single scar. That's the first condition. After we have eliminated the fact that it was not an absolute indication. It was not a permanent absolute indication. It was not a permanent absolute indication. This is it. Single scar. First condition, single scar. So if you have a double scar, you're already eliminated for that. A C-section. And you still have all your babies, and you still live your life normally and well. You see, if that happens, the next reason is that after you went through C-section, you gave a time. In the past, women used to be asked to stay for 2 years before they conceive again. But researchers have proven that within 6 months, the uterus heals totally. The uterus heals completely within 6 months. The uterus heals completely within 6 months. And when the uterus heals completely within 6 months, the woman, if she conceives after 6 months, uh, uh, she could try. We could do a trial of scar. We could do a trial of scar in such women. We could do a trial of scar in such women. But if she conceives before 6 months, then the scar is still healing while another pregnancy is already inside. That one disqualifies her from going through a trial of scar or VBAC. In that case, she will need to be operated. And if she is operated and it becomes a double scarred uterus, then she will have all her baby by C-section. By C-section. The other condition is that the woman gives her consent. She gives her consent that yes, I want to go through C-section. She gives her consent that I want to go through C-section, and she must sign. It's very important. She must sign. Very, very important. Very, very important. Now, the other reason is the type of incision that was done on her uterus. When doctors operate you upon you, do well when you are leaving the hospital. There are two things you must know. There are two things you must know. What was the reason for which I was operated, doctor? What was the reason for which I was operated, doctor? One. Two, what type of incision did you do on my uterus? Because it will help you. Many women, when they come back, some of them were told, but they behave as if they weren't. But many don't know. So what I usually do in my case, for my colleagues who may be watching this, is that when I'm still in the theater, I start telling them, especially when we are doing a spinal anesthesia, I start telling them that this is what we are having as a challenge. So next time, if you don't see me, this is what you should do. Another thing we do is that we give a report. A report. We do a post-op report uh, for the patients so that they know it. Sometimes they have to carry it. Many of our structures, I'm guilty even of that. Sometimes we hardly even give that. We don't give that, but it's good to give a report so that she carries it along with her. These two things are very, very important because the uterus has several portions. There is a particular portion that if during C-section, because maybe you can go and face challenges in the abdomen, you finally do an incision on another part that's called the corpus of the uterus. That becomes an absolute indication. Because a woman, when she's pregnant, there's a part that is formed that is called the lower uterine segment. It is from there that we give her incisions and remove the baby. I will not want to explain the details to you. Of course, it's reserved for us health workers. But so you need to know this. Very, very, very important. Important. The type of incision that was done on the abdomen does not matter. It is the one that was done on the womb, because when we do, I told you, cesarean section means you cut open the abdomen and they also cut open the womb or the uterus. Yes, the type of incision we did on the womb, that one matters a lot. That's what determines everything. Thank you for the beautiful comments. I'm seeing my friend Peter from the US, my brother and friend Clovis from Denmark. Please write from where you are watching. I would like to see that. Write that we are watching you live from Denmark. I like that. I like that. From the US, from Cameroon, from different countries. Thank you. So that is it. Now, fetal reasons. There are fetal reasons. There are reasons linked to the fetus. There are reasons linked to the fetus. And I'll tell you that the reasons linked to the fetus are the major determinant for whether you will go through C-section again or you will go through a trial of scar. We will do a trial of scar or you have a VBAC. For example, fetal reasons. One, if you went through C-section and your fetus or your baby presents in breech, is not cephalic. The first thing is that the baby one is cephalic, must be lying cephalic with the head down. Some of them will be sitting down. If it's not cephalic, because when you go through C-section and want to do a trial of scar, your labor should not take very long. It should not take very long. And there are some presentations that can prolong your labor. And if labor takes long, what do you think is the risk? The risk is that the scar gets weak and can rupture before time. So your baby must be cephalic to permit your baby to descend easily. That is one, to permit your baby to descend easily. The second reason, because when you go and do an ultrasound, the doctor will be explaining to you that we have checked you and you have well operated before. We see that your baby is sitting. That's how we say it, so I better understand. And with this, labor will be risky. So it's good to operate. And some patients are saying, no, this is not my portion. It's because of a science. That's how it is. God could turn the baby. God could cause your baby to turn again. But until that happens, know that you're a candidate for another C-section. And have your peace of mind. Have your peace of mind. Have your
Very
peace of mind.
important.
Most important thing, good mother,
Good
good
baby.
baby. That is it. As I have her here. As I have her here. You see, so that is it. That is it. The second reason, which is one of the major determinants, is the weight of the baby. The weight of the baby. In our country, because some countries have their own different thresholds, the threshold in our country is 3,500 grams, 3.5 kilograms. Your baby should be below that weight before we do a trial scar. If your pelvis is normal. Once your baby is above that weight, the risk is that the baby is big. We call it big baby when it's between 3.5 to 4. Big baby. During labor, the baby is already big, and there's also the amniotic fluid. The uterus is distended. The risk is that during contractions, the scar gets weak faster and may rupture. That's just the simple reason. So to avoid that risk, we advise C-section. Though I always say some people still deliver somewhere a little bigger than that.
Mhm.
But if we
Just
notice
follow.
on ultrasound and we examine, we judge, we advise C-section. Because delivery is not a risky venture. I've said it over and over. It's not a risky venture. It is a matter of wisdom. It's a matter of wisdom. It's not a risky venture. It's a matter of wisdom. It's a matter of wisdom.
Quality of
That's
your
delivery.
baby.
And the quality of your baby. The quality of your baby and your own life too.
Mhm.
Your own life too. This is what we focus on. This is the most important element. This is what we focus on. All right. Yes. So once the weight is above 3.5 in our setting, we advise C-section. Once your baby has any other presentation apart from cephalic presentation, we advise C-section. Could be transverse, could be bridge, could be oblique. And then another reason is that you should not get to the point where we would start thinking of giving inducing labor or giving you forced labor, as many people know it. Forced labor means that we we give you drugs to provoke labor, and that happens because you have gone above the time. You have what we call a prolonged pregnancy. In our setting, a prolonged pregnancy is from 41 weeks. From 41 weeks. From 41 weeks, but a post-term pregnancy, when they say time has really passed, is after 42 weeks. In some countries, especially in the Western nations, they start taking decisions when the pregnancy has gone beyond 42 weeks. But in our setting, we don't wait till that time because we notice that the placenta gets old faster in our setting. And also, our means of displacement, transport, our theaters are not, hospitals are not as equipped. Our roads are not as good. Our ambulance service is not as good as Western nations where they can just take their decision in a twinkle of an eye and solve it. So in our setting, we take decisions on that just after 40 weeks. We do that. Sometimes, most of the time, after 41 weeks. And when you have a scar and you have already gone beyond the time, we will not give you false labor. So we usually go ahead to do C-section. To do C-section. But if we know the person that operated you, we can, for example, if you see somebody and the person tells you Dr. Nzometia did the CS, they know that Dr. Nzometia is a well-trained gynecologist. So they are sure that he did a good job in the abdomen. And so sometimes during labor, if labor progresses onto one point and then it stops, what we call dynamic dystocia, they can give a small contractions, but it should be the doctor. And when doctors give it, they stay
Stay
beside,
there and
they stay
observe.
there. It was done on her
Mm.
because the first person that operated her was a gynecologist. And when she
Perfect.
was in labor, I took her to a reference hospital where they were gynecologists. So when they did that, they sat there and monitored. And we didn't sure why she put to bed.
Oh,
So it is what we
oh.
call military surveillance. When you do that type of thing, it's high risk. So don't go, maybe you are a nurse watching us, a doctor in one structure watching us, and then you go and do this, and then you see a uterus rupture. Don't do that when you don't have the competence, the required competence. You don't have the right judgments yet. But when we speak and we can take decisions faster and intervene. That's why sometimes we do some things. That's why sometimes we do some things. But besides that, when the time passes, we don't induce. So those are most of the reasons linked to the fetus. I've given you the reason linked to the mother, the reason linked to the fetus. And now the last but not the least condition is that the person that will deliver you must be an experienced birth attendant.
Mm.
Very important. It must be
Preparing them.
somebody It must be somebody that has been doing this.
Mm.
Don't go and see a novice. You are in labor because you are afraid that they will tell you that they want
Trying
to
to
operate you. That's
use
what many people do in our setting, and they have all types of
trial
complications.
error.
You go to a health center where they have never done anything, they don't have any experience, or they don't have a theater. Because when you have gone through C-section, your next delivery must, I repeat, it must be in a hospital that can do another C-section. Don't go to a hospital with inexperienced people. One. Two, where there is no theater. Three, where the means of transportation is poor. And then when it becomes an emergency, they start struggling, and before you know it, complications come. This is not wise. This is not wise. So I've spoken for a long time. I'll give room to the moderator, my beautiful wife, to say some things
What
and
a
maybe share our
moderator.
experience. And if you have any question, you are free to ask.
Thank you so
You are
much,
free to ask. Thank you for all the comments.
our favorite OBGYN. Shout
Thank
out
you,
to my
Courage from
OBGYN
UK.
too. Oh la la, and all the
Uh,
amazing doctors that we have out there doing amazing jobs. We appreciate you. We love you. May the Lord continue to strengthen you in your endeavors in Jesus' name. Okay. One thing that we did, which we shared in our previous video, if you've not watched, you may want to go and watch that, was that if you have a relative, if you had a relative indication, you went through a C-section because of a relative indication. For example, cephaloperia disproportion, maybe because the baby was a big baby, and your pelvis is actually normal. Your healthcare provider has told you about the situation of your clinical presentation is okay and all of that. And the only reason maybe is the weight of the baby. We spoke about it last time. One thing you want to do in your next pregnancy is to control the weight of the baby so that you can try the vaginal delivery after a C-section. So it depends on the indication, like he already explained. I just wanted to add this part for those who, for example, may not know the reason, or one of the reasons, that's not the only reason why it may result in a cephaloperia dysfunction, maybe why their pelvis is okay. So people will say that they said that my road, they was calling my road, they said that my road was okay, yet they still operated me. Most of the times is linked to that. Maybe the baby was bigger than your road. So this time
and some
around,
people confuse their cervix opening from their pelvis
yes,
being normal.
something.
But when they say a road is not yet open, sometimes they are talking about your cervix. Your
Mm.
cervix is the one that remains closed when you are pregnant to keep the baby in the womb until the time comes when you enter labor before it dilates and opens. But when they talk of your root, they're actually talking about your pelvis.
Yes.
Is your pelvis open enough?
Mm.
And my beautiful wife said something very important. We have done a video on how to control the weight.
Yep.
That's one of the main means by which we achieve VBAC,
Mhm.
vaginal birth after cesarean section. Because if the weight is good and you are properly prepared, your chances are very high. Most of the women we have succeeded recently are people we have followed up for long. The babies were 2.7, 2.8, 3.1, 3.2. They all, most of them delivered. Most of them delivered. So we see, yes.
And just to say that don't get into a space where you're accusing yourself, you're feeling bad because maybe you wanted a vaginal delivery and it ended in a second cesarean section. It is still a
Wow.
means of delivery.
Yes.
You've done nothing wrong and you have no reason to be guilty. You are a
Yes.
great mom, you're a great woman, and we celebrate you. And of course, you have to celebrate yourself. Carrying your baby for 9 months, really a lot of work that you did, and bringing out your baby into the world. Good baby, good mother, that's our objective. Not allow anybody to victimize you. There's nothing absolutely wrong in going through a C-section. We spoke about that in our first video. If you want to go back and watch it, overcoming the stigma of the cesarean section. And don't give anybody the opportunity to cause you to be guilty. Not at all. You have no reason to be guilty. You're a strong woman.
Indeed, really a strong woman, just like you. Who knows? She has gone through two C-sections.
Say that
Two
again.
C-sections. Even after a
Yeah.
VBAC. So
Mm.
after a VBAC, you could still go through a C-section.
Mm-hmm.
And we are not guilty about that. We are
At
happy because we
all.
have our beautiful
Ah.
babies here with us. And we enjoy them, and I enjoy us too. You see it. So there is no guilt. My friend Peter said something very important. He said, the men hesitate to sign.
Yeah. Oh my
The
God.
men who are watching this, we
Ah.
pray you are really receiving this education.
Don't do
Because the
don't
signing
do
the
that.
consent depends mostly on you to say, I permit that my wife should be operated.
Mhm.
Because sometimes your wife is refusing because she's afraid of you. Sometimes she's thinking
That's
how
true.
you will react. We are having cases here where sometimes the woman will say, until my husband come, nothing will happen. You see the baby is suffering, her life is at risk, yet she's waiting for the husband. So I want that the tide should change. I'll do a video on this. Where instead of mothers accompanying
Their
their
daughters,
daughters to the hospital, their
their
husband should be
husbands
the
take
first
it.
partner to accompany them.
Should
Because
be
when they
now.
need to take a decision, it's not always the mothers. They'll start saying that I want to call my husband. We are trying to reach him.
My
Network is
husband is not
disturbing.
going to.
And time is
Ah.
passing. And in obstetrics, the time factor is very important.
Time is gold.
So let your mothers come, yes, but be there. Because most of the time, imagine women are full of emotions, I told you. And then they see you crying pain and they start crying. Instead of being strong for you, encouraging you. Those some men who usually cry, we have had some few cases. But it's always good when they are there because when we need to take a decision,
Yeah.
they take it fast. If we need to get materials, they can easily run to do it. This
Sharp,
is it.
sharp.
Yes.
That, yeah, big, yeah.
Thank you, True Review.
That's
Thank you
good.
for your comments. Thank
Yeah,
you,
yeah,
Courage. Thank you, Peter. Thank you for all the comments. Do we still have any question? Is there anyone who has a question or a comment concerning this? All the people who are watching in silence, you can still write
yeah. Oh,
something. You can
yes.
ask a question, or you can just like.
And of course, subscribe if you've not done so, and share this video. We want this video to reach every single individual on planet Earth because
Wow,
our objective is to promote safe pregnancy, safe delivery,
wow,
where you come up with a quality baby, a good baby, not babies that will come out and then you'll be regretting that if you knew you should have just accepted the C-section, or oh, I lost the baby. Oh, those are so painful stories I don't like
or
to
a
hear.
good mother.
Good mother, of course.
Yes, we are going to be
Mama has to be
talking
strong to
on
carry again.
why they should do antenatal care. We have explained that in some of the videos. Today, I did a C-section for one of my patients who has had vaginal deliveries twice. And why? And we did it at 36 weeks of pregnancy. Because in the course of our pregnancy, we discovered problems that we had to handle urgently. And we handled it today. I just saw she wrote me saying, "Thank you so much." And I was so fulfilled. And the baby came out, and exactly what we found in her follow up, that's what we saw. And if we delayed, there would have been problems. Imagine that she didn't come for follow up. So we are going to do a video on this.
Stay tuned. Thank you so much, our amazing viewers, for watching this amazing video. We're all so blessed whenever you come and also drop comments, ask questions. Please keep it interactive. That's the objective of this session. For you to
Yes.
ask all the questions you have. Invite your friends, invite your wives, invite the neighbors, and any pregnant woman that you know, a mom to be or dad to be to be analyzed. And if if they're already going through it, so feel free to come and drop their questions and we'll always answer and get to them. If you'd like to be followed up privately, feel free to get to havilaspopmarriage@gmail.com. We will check the description link to our WhatsApp contact and contact us.
Wow. Thank you. And please do share this on your status, share on your Facebook, share on your Instagram. Share so that many people watch this, know about this program.
Oh yes, yes, yes.
And we are ready to be invited even for conferences to talk about these things.
Mhm.
Thank you very much. God bless you.
Mm.